I think one day, though, we will be talking in terms of having children is a part of what we make, and you feel responsible at an earlier and earlier stage. Even before you conceive, you're thinking about what kind of child is going to be okay for us. One day, genetic tests will be so inexpensive, every couple will be able to use pre-implantation technologies like those that Dr. Griffo has proposed, and we'll all have to ask the question, what's okay? What do I really want from making a child?
In desperation, she tried the powerful drug Pergonal. It worked, a little too well.
The ultrasound technician right away said there's two, and I kind of thought, oh, exciting, twins, and she said, wait a minute, there's two more.
It's a big mistake to start talking about multiple pregnancies as a gift from above. It's a miracle that these children survived. It's not a miracle they were brought into the world. They were brought into the world through medical malpractice.
Ethicist Glenn McGee believes physicians using potent fertility drugs should have to be certified to use them and held responsible for children born with severe health problems.
I think it's a moral problem, but it's enough of a moral problem that you got to back up and say, hey, socially, this can't happen. We've wondered about the tough ethical issues. They arise when you don't have enough organs. So in these cases, we've got really three different levels where the decisions are made. The decision about whether or not Mr. Steen should get an organ is really made in the first case when it's determined whether or not he has insurance that can pay for him to receive an organ. If he doesn't, or if his insurance isn't sufficient to cover transplantation, he's got an exclusion, and as so many Americans have, then he's not going to be considered by the committee.
I've been fascinated by the reaction to this story all day long. It seems to be equal parts wonder and discomfort bordering on disgust.
Yeah, you're right, you're right.
What's wrong with a 63-year-old woman having a baby?
Well, I'll tell you what I don't think is wrong with it. I've heard the same comments you've heard, and I've heard some people say some, frankly, very sexist things. Essentially that menopause is a brick wall, and that we ought to say it's unnatural, or it's just plain wrong, or even playing God to have a baby after your menopause. That's crazy. Some 63-year-olds in the right family situation with the right motives might be excellent parents, and I think we want to leave the door open to that. We don't want to pass a law that says this is wrong. But what we do need to have is a real assessment of the motives and the resources. It's the child's best interest we're concerned about. What kind of world would we be bringing that child into?
Jan, I have bad news for you. And I said, and my heart was going, doom, doom, doom. And I said, what is it? And my ears were getting hot, and that panic. And he says, the results are no good. He says, I'm so sorry, but it's very severe deformity, and I really think your only option is to terminate.
So she did. And now Janet Shahan and her husband think that the hospital made a terrible mistake, and there was no reason for her to have an abortion. Glenn McGee, a University of Pennsylvania bioethicist, says he's troubled by the way Mrs. Shahan was treated.
Once the hospital and everyone else began to see that there was a problem, instead of rushing to the aid of this patient who's, been put in an awful position, even if no one's at fault, everyone began sorting papers and figuring out how they're not responsible.
Should Janet's obstetrician be held responsible for this? He had the two different results in his charts.
I think Mrs. Shahan is clearly being charitable to her obstetrician. Ultimately, it's his responsibility to make sure that there's a continuity of care, that she knows what she wants to know.
I'm wondering if anybody has any sense of how many times this happened.
No, there's no way to know. There's no way to know. If she weren't who she is, articulate, careful, capable, she never would have discovered this. I bet she wishes she hadn't.
Dr. McGee, what do you see as an acceptable regulation?
Well,
a starting off point. Where would you begin if you were going to do this?
That one, I think there's a home run here on this one. There's an easy answer. We can't just jump headlong. As you said, Carol, this is a very difficult set of issues, and we've got to go slowly. So I think a couple of clinics beginning experimental protocols where they enroll couples and follow up. I mean, just to find out silly things like what sorts of children's stories do you tell these kids? What do you tell them about their other parents? What about how they grow up and so on? We've got to see what happens in the first few years for the first few children before we open up the floodgates. and allow embryo adoption to become de rigueur.
Do you agree with Dr. Ziegler that the train has left the station?
Well, yes, and I agree, moreover, that the right approach here is to acknowledge that Americans correctly press for scientific advances and about reproduction. I think we have to shift our focus a little bit. Instead of asking what we shouldn't do, what the big wrong is here, the focus should be on education. I find it amazing that here in the context of a program, the Human Genome Project, that has devoted an unprecedented amount of money, more than $150 million dedicated to the study of ethics in reproduction and in genetics. We don't spend a dime on training research scientists in this country about ethical understanding, about social implications. We treat these issues after they're already in our front yard, as it were. We need to shift the focus to education.
Dr. McGee, what's the status of the Genome Project?
Well, it was
and what is it?
It's a 15-year project, $3 billion, a lot like the Apollo mission in that lots of people are involved and the goals are very ambitious.
What's the mission?
The mission is to map the whole human genome, to figure out what all our genes do, how they work, how to use them to create new drugs, new therapies, and maybe even to provide genetic tests. In any case, the question for the next millennium is what's in the dish? What have you got when you take bits and parts from different species, from different kinds of people, from different cells, and grow them for making bags of liver tissue or curing Parkinson's? How do you know when it's an embryo? The abortion debate is dead, and it's going to be replaced with a new debate about what's in the dish. Lots of college-age women have about $20,000 in credit card debt. $50,000 is, if anything, overshooting the mark for the audience that they've applied to. I think there's a lot of danger here, though.
What is the danger for someone who thinks in their debt-ridden college days that they can just give up an egg and forget about it down the line?
Well, that's the thing. You really can't forget about it down the line. Americans really sort of rocked to the movie Secrets and Lies a couple of years ago, which chronicled how adopted children have come to find their biological parents and what a sort of rock your world experience that's been for so many Americans. This is the same kind of thing we're going to begin to see with egg and sperm donation, and I'm worried about the informed consent procedure for a number of these kinds of donations. I wonder if these donors really recognize that 20, maybe 25 years down the line, they're very likely going to be contacted by the people who received the donation, as it were. I think our families don't want us to go gently. They want us to recapture some meaning, to write a history of our lives. And the prospect of an imminent death from something like cancer really forces us to think hard about what it is we want to fight for. It's tempting, I think, sometimes to accept unacceptable odds. In this piece, we hear about a 25% chance of 5-year survival from the best available chemotherapy. In other parts of medicine, that kind of odd is almost experimental medicine, but we'll accept it in cancer and chemotherapy because we want to survive and we want to fight.
Glenn, I'm telling you, if I'm diagnosed with a disease like that, I don't want to hear how much it's going to cost to treat me.
That's right. You want to fight the good fight and struggle, and that's appropriate.
Is that wrong?
No, I don't think so. I think it's one of the most laudable things about our culture. But what we haven't done is to provide cancer patients and others who are dying with a way not to go gently that doesn't require them to undertake futile treatment. So it shouldn't be standard of care to even offer a patient or a family an oncology that won't work, or isn't likely to work, or is likely to work only very expensively for a very small number of people.
Professor Glenn McGee is at the University of Pennsylvania's Center for Bioethics.
We shouldn't make children from the dead, whether it's sperm banks or donor eggs or in the families where we're talking about harvesting from dead husbands, or even through cloning or other new reproductive technologies. And the reason for that is simple. Unless there's clear consent to make a child in this way, it violates the rights of the person involved. I think we've got to stop this, nip it in the bud, before it becomes a phenomenon of people having babies either through cloning or post-mortem sperm without permission.
We just heard in that tape that some couples pay up to $200,000. That's astronomical.
Most of these couples have second mortgages. They fill up I call it the platinum card effect. You really have to have a lot of disposable income to get invested in this. And the more you get invested, the more you get invested, because once you've got one technology, there's 10 more that you could use to get yourself across that line.
Well, one of the cases that received a lot of attention recently was the white couple who had the twins. One twin was black, one twin was white, and now I hear she's given back the black twin.
Yeah, there was a mix-up where they implanted in this couple, in this woman, an embryo from another couple along with their own embryo.
She gave back the black twin to the black couple for
Right.
whom it was there.
But what if it was her only one, and she'd gone through that pregnancy, and she'd bonded with that child 3 months old? I mean, she might say, I want to keep this baby. I mean, I'm the mother, I was the carrier, and so forth.
The black couple had been through a couple of cycles of in vitro fertilization unsuccessfully, and they felt like this was a child that they had invested in.
And they wanted the baby back.
They have the baby.
Right, and they now have the baby.
And all of these create new kinds of parenthood, too, because everyone still stays involved. I mean, lots of kids have multiple parents and grandparents these days, but it's not the birds and the bees now, it's the ants and the termites, right? You've got 3 moms and 4 dads and grandparents and daycare. It's a whole new world.